Hi, I'm Dr. Peter Andersen from Livonia Alternative Health, and today I'd like to talk to you about carpal tunnel. Now, carpal tunnel symptoms may not be caused by carpal tunnel at all, because a lot of doctors use pain into the hands and the fingers as a blanket term to just, you have carpal tunnel, go to physical therapy, here's your Motrin. If it doesn't get better, we'll get you surgery. So let's talk about, there are two carpal tunnels. One that affects the ulnar nerve, which affects these two fingers, and one that affects the median nerve, which affects these two fingers. Now, if you had severe trauma to your hand or wrist, it may affect both of those, but what if it's also affecting your thumb? Well, that may not be, if you didn't have any actual trauma to your hand, it could be compromise at the elbow, compromise at the shoulder, compromise at the neck and upper back, because the nerves from the neck and upper back, they travel all the way down to your fingers. Now, a surgeon will go right to the wrist, and there's this section of connective tissue called retinaculum, which helps to reinforce the tendons as they connect to the bones of the hand and to the forearm. Well, they make a couple slices and they go in and they do a retinaculum release. So once they cut that, yeah, you may have created more space for those nerves, but now there's no reinforcement for those tendons, so you're going to have hand weakness the rest of your life. Now, if the problem is coming from the neck, upper back, and shoulder, a lot of the problem could be our posture right from the get-go. In our society today, we end up holding our head forward from our shoulders, probably because we're either having to deal with construction and we're in a car all day, or we're at a computer for hours at a time, or we're texting for God knows how long. And this is the weight of a bowling ball. Each inch forward adds about approximately 10 pounds of tension to these muscles. Now, as the muscles on either side of the spine are under more tension, that causes the vertebrae to lock up. And when that locks up, the joints that aren't locked above and below are going to have a lot more uneven wear and tear. And that's where a lot of compromise to these nerves that go down your arm can happen. The other thing is, if you hold your head forward from your shoulders, guess what? It pulls your shoulders forward. So now that affects our posture as well. And it also affects the alignment of the rotator cuff, which then can compromise the nerves at the shoulder. One last thing that can contribute to this is an imbalance of muscles. Now, we grasp things all day, whether we're lifting boxes, or we're grabbing onto things, or we're typing. So our close, the muscles that cause our hands to close are working more than the muscles that cause our hands to open. So a simple thing to do to start to correct that imbalance is take a thick rubber band, put it around your fingers, and work your open muscles. A set of 10 a couple times a day. Within 2 or 3 days, you can notice a big difference in the strength of your hand. So it's very important to have your body's frame assessed for where nerve compromise is before you submit to the idea of undergoing surgery. If you have these symptoms, you don't have to suffer. Call for a consultation and evaluation, and we can figure out what we need to do to give you long-lasting relief from carpal tunnel or carpal tunnel-like symptoms. Surgery free.